Let me be clear, Rhinophyma is not just a large nose, it is a process that gradually changes it, often without one even noticing it. If over the years the skin of the nose has thickened, the pores have become more visible, and the contours have grown heavy and irregular, it is not just a natural shape. The key question is this a genetic trait or is it a condition that is currently progressing? Now I will explain how to recognize it in the early stages, what makes it worse, and which treatments truly make sense before it advances. Hello, I am Dr. Skerdi Faria, founder of Keit Day Hospital. Today I want to talk about Rhinophyma, a condition that in common language is often referred to as a large nose, due to the obvious changes that develop over time in the appearance of the nose. This definition is used because the nose tends to increase in volume, thicken, and take on heavier contours, becoming more prominent on the face. From a medical standpoint, however, Rhinophyma is not related to the natural size of the nose, but represents an acquired biological process that mainly affects the skin and soft tissues, developing gradually over the years. It is essential to distinguish between a naturally large nose and Rhinophyma. A naturally large nose is an anatomical feature present from birth, sometimes genetically determined and generally stable over time. In the case of Rhinophyma, however, the change is not congenital but appears progressively, worsens with the years, and is not part of the original structure of the face. For this reason, even if in everyday language the appearance can be described with the same term, the cause, mechanism, and treatment are profoundly different. Rhinophyma represents the advanced stage of rosacea, a chronic inflammatory skin condition that mainly affects the central region of the face, including the cheeks, nose, and chin. In the early stages, rosacea generally manifests with recurring redness, increased skin sensitivity, and heightened reactions to external factors such as heat, cold, irritating foods, or emotional stress. Over time, if not managed continuously, the inflammation becomes chronic and begins to involve the structure of the skin more deeply. The main cause of Rhinophyma is precisely this persistent and uncontrolled inflammatory state, which stimulates the enlargement of the sebaceous glands and the progressive thickening of the nasal skin. This process leads to an actual growth of the tissues, making the nose more voluminous, heavier, and with an irregular surface. It is not a transitory swelling or a temporary change, but structural transformations that occur on living tissue and that tend to progress over time. Other factors also contribute to the development of Rhinophyma, such as genetic predisposition, changes in blood circulation in the facial region, the lack of early and consistent management of rosacea, and prolonged exposure to irritating environmental factors. These elements do not act in isolation. They interact with each other over the years, making the process slow, progressive, and often barely noticeable in the early stages. In the early stages, changes are generally mild and frequently underestimated. The skin of the nose may appear slightly thicker, with inconspicuous pores and a surface that feels rougher to the touch. At this stage, many people describe the appearance as a bit larger or slightly swollen, without realizing it is an evolving biological process that, if left unchecked, will continue to progress. In these early stages, treatment focuses primarily on controlling rosacea. This includes using topical or systemic antibiotics to reduce inflammation and control any infection, and in selected cases, oral isotretinoin to limit the activity of the sebaceous glands. The goal of these therapies is to stabilize the condition and slow the progression, but not to change the shape of the nose. It is important to emphasize that medical treatment at this stage acts on inflammation and skin quality, but cannot change the shape of the nose once actual tissue growth has already begun. This aspect is fundamental for setting correct expectations and avoiding later disappointments. Over the years, if inflammation persists unchecked, the skin thickening becomes increasingly pronounced. The natural contours of the nose are gradually lost, the structure appears heavier, and the appearance changes significantly. At this stage, Rhinophyma is no longer just an aesthetic issue, but also becomes a real source of psychological and social distress for many people. When Rhinophyma is advanced and actual tissue growth has set in, conservative treatments are no longer enough to correct the deformity. In these cases, effective correction requires physical interventions aimed at reducing excess tissue. The most common techniques include CO2 laser treatment, which allows for controlled removal of thickened skin and progressive shaping of the nose with high precision. Other alternatives include surgical removal of excess tissue, electrocauterization for cutting and coagulation, and dermabrasion to smooth the skin surface. The choice of technique depends on the degree of rhinophyma, the condition of the affected area, and the realistic goals of the treatment. Plasma can play a supportive role in improving the quality of surface tissues and during the healing phase, but it doesn't represent a corrective treatment for advanced rhinophyma. It doesn't reduce excess tissue, nor does it change the shape of the nose when the volume is significant. Therefore, it shouldn't be considered a primary solution in these cases. In some selected situations, when rhinophyma has also involved the overall structure of the nose, rhinoplasty can be considered as part of a reconstructive approach. This isn't a classic aesthetic rhinoplasty, but a procedure aimed at harmonizing the nose with the face after the reduction of excess tissue, while respecting the actual anatomy and function. It's essential to understand that rhinophyma is the result of a long-term biological process that requires a responsible medical approach, clear explanations and realistic expectations at every stage of the treatment. In clinical practice, one of the most common mistakes is comparing the actual result with idealized or digitally modified images. Rhinophyma cannot disappear overnight, and it cannot transform the nose into a shape that doesn't belong to the person's anatomy. The result must always be evaluated in relation to biological and functional reality. In conclusion, rhinophyma is a progressive acquired condition linked to chronic rosacea, which in common language is defined as a large nose because of its appearance. Distinguishing between the way it manifests and its cause is fundamental for choosing the correct treatment. The doctor's role is to clearly explain the limits of each therapeutic option, define realistic expectations, and protect the person's long-term well-being. Thank you for your attention, and if you liked the video, please give it a like, share it, and subscribe to our channel. Until next time.